Well, hello, everyone. This is Helen Foley, and this is one of our very first meetings of the combined marketing and donor relations committees into our new subcommittee. So I'm happy that you're all here today. I've gone over the agenda, the items that Andrea has been discussing. There's quite a bit for us to accomplish today. So, Andrea, why don't you go ahead and get started here?
Fantastic. So the reflection today is very simple, but poignant, I think. We make a living by what we get, but we make a life by what we give.
Very nice.
That would be Sir Winston Churchill. And let's see, moving right along. All right, let's jump right into this agenda. So, Summerlin Rotary Gala. Brenda, if you want to speak on this, the floor is yours. For those of you, I will send out an updated agenda because I know the original one I sent out did not have the date of the event as well as the URL. But this one does, so I will make sure to get that information to you guys after the meeting.
Sure. So there is a Summerlin Rotary. It is a small new chapter, but they are doing great things. And last year they did host another Mardi Gras Gala that benefited Delivering with Dignity. There's always a charitable component to it, and they supported primarily Delivering with Dignity, but there are some other food insecure organizations. So St. Rose Dominican Health Foundation ended up being there just because of a prior link with a board member who had moved from California, and a Dignity Health Hospital over there had purchased a table. And long story short, we attended. Great event, a good group, small but mighty. And as I was exploring with them, getting to know more about what they do and how they do it, and how potentially I might be involved on an individual level, I met one of their board members and the man who's on the foundation for the Summerlin Rotary. And we started talking about St. Rose is interested in increasing our visibility, awareness of the community in Summerlin, about particularly our San Martin campus, etc. And because of their charitable component, they will raise funds, but then distribute it as well. So long story short, we have purchased a table. We are confident that they will be supporting St. Rose in some capacity as well, because of our support. And there's going to be another Mardi Gras Gala on Saturday, February 17th. It's at the JW Marriott out here in Summerlin land. And last year it was a lovely event. I believe they had 450 people attending. Not sure how big it will be this year. This year it's supporting the Just One project again with food insecurity, etc. There is also the possibility that we are currently discussing about St. Rose being the beneficiary of their 2025 gala. So nothing is finalized, but again, conversations are proceeding, and there's some potential excitement there. So with that, we do have a table at this event. And if you are interested in attending, please reach out, let us know, and we'll see if we can fill our table and have you there being great ambassadors for St. Rose.
Brenda, I don't want to take seats that you would otherwise have your staff attend, but I would sure like to have some board members there. How many do you think you'd like?
We right now have room for 4 seats, potentially 5 seats. So yes, again, if you're interested and available to attend, please let us know. We would love to have people there who are able to network, work the room, spread the word about St. Rose, and get to know a little bit more about the Summerlin Rotary and the good they're doing in the community and how potentially we can partner.
Great. I would like to attend.
Great.
Just for one.
Okay, great.
Anyone else?
We can reach out to other board members, particularly those who do live in the Summerlin area. It might be certainly more convenient.
Yeah, I'll be out of town. Otherwise, I would say yes, since it is Summerlin. It's right down the street.
Right.
Yeah.
Great. All right.
Okay, thank you.
all. Mhm.
Okay, and the Las Vegas Weekly, Andrea?
Yes, so we have a small marketing budget to use towards promoting the foundation. And I know that Las Vegas Weekly, or I should say the Greenspun organization, has a nonprofit magazine that they put out, I believe, in the summer. And so we are considering doing some advertising in that particular publication.
No caller.
So I do have a meeting set up for next week with them to discuss this. And I will have,
When you talk about advertising, as it relates to the foundation, what kind of emphasis do you want? Do you want something that would appeal to giving back, or?
absolutely, I would say creating awareness and letting them know that they can give. So right now it's in the early stages. I'm not really sure. I haven't seen a recent copy of the fundraising. I don't know if you guys have seen it. It's a large print. It's a larger print magazine that has all the nonprofits in the Valley.
No, all the nonprofits that pay to be included in it.
Okay, that's insightful.
Well, it would be nice to see how others approach it, because I would sure like for it to be something more than just the hospital. It's something about the only Southern Nevada nonprofit
Yeah.
faith-based hospital that, for them to be able to give.
And I
Absolutely.
don't know if it's still true, but they used to be, you got one page that had it had a standard template, it listed, the basics and your tax ID and your board members and your mission. And then depending on the donation level, you would also get a full page ad or a half page ad or something like that. So, obviously there's a little bit of personalization that can go on the template side, but then the ad can be whatever we would
Okay.
like it to be.
Well, why
If it's
don't
still the same.
Brenda and Andrea and anyone else who would like to participate, I'd love to kind of brainstorm on the most effective way to advertise in this publication. We can do that. Just
I
over
will
the
let
phone.
you and Andy deal with
Okay.
that.
Okay.
The
Thank you.
experts. Mhm.
All right.
Okay, now on to the brochure.
Yes, so this is early stages. Excuse me, I have a cable right in front of my screen where I need to go. Brochure, very early draft. So I am working on creating a brochure that I believe will serve multiple purposes and can be customizable for many initiatives. So what you're seeing is a very early draft. I have not put in a lot of the photos because we need to tighten up the content first, and that'll drive where the visual placements of things go. So right now, this was intended originally to be a naming opportunity brochure. So places to heal, places to gather, and places to lead. And then when you get to the very end of it, there's these pages that would have the locations available and what they cost to a donor to sponsor. So as I was creating this and looking at this, I said, gosh, this would, if it's done properly, this could be a great case statement. This could also serve, thanks to Helen's insight, it could also serve as, if we were to customize it for individuals and companies, it could be a great talking point when we're trying to present to these individuals and companies. So it can be many things. But I want to let you guys know that it is in its early stages and I am working on it right now. So it should be done hopefully within the next month.
No, I don't know if it's up to someone higher up, but my initial reaction to this is that to do it right at the beginning, the very first page. We've talked about Dignity Health, we've talked about Common Spirit, we've talked about St. Rose and not losing the St. Rose format. But as I go through, it talks about campuses, but it doesn't really say that they're hospitals. Could we say St. Rose Dominican hospitals? Or is it something more than hospitals? Are you trying to do things with medical facilities outside of hospitals?
That's a great question. I think I would probably have to put up that question up to Chad and maybe senior
Okay.
leadership. Yeah.
I mean, I don't know about anybody else, but Dignity Health, sometimes as we talked about before and with the interviews with our capital campaign, sometimes dignity means hospice, you dine with dignity and those kinds of things.
Dignity Funeral Homes.
Funeral, right. So to clearly show that St. Rose Dominican are hospitals, just St. Rose Dominican hospitals would be my suggestion.
I think that's a great point. I wonder too, we use the term campus, like you said, but that, I can see how that is confusing.
Right. Well, and I don't mind having different campuses because you do have the different hospitals, but somewhere you certainly need to let them know what we are.
Yeah, I agree with you, Helen. I think that feels like an internal kind of a thing that's meaningless to everybody on the outside who aren't staff. I don't think it's terribly meaningful, and dignity. Well, we all know that that's been a challenge with the the identification. Who are we? And unfortunately, I'm starting to see more and more organizations with dignity in that name locally, which is not a good thing.
I know
Right.
that and this is not a secret, we are getting away from the Floret and the Dignity Health. But that's going to be in a few years when we actually make the jump to Common Spirit in branding.
The lifetime from now. Yeah.
Yeah. So these are still great questions though to pose, the language that we're using to market and promote ourselves.
Right. And the most important part, at least in our eyes, is that it's St. Rose and it's St. Rose hospitals.
Yeah.
And I don't mind St. Rose Dominican hospitals. I don't mind that at all, but the important part is hospitals too.
Yeah, no, I would not. I don't think so. What would change, and this is just my thoughts, are the Floret and Dignity Health would go away. So it would be probably Common Spirit, St. Rose Dominican hospitals. I'm
Right.
guessing.
Or put that exact logo smaller in a corner and have St. Rose Dominican hospitals,
Yeah,
like in text,
yeah.
Yeah.
but
I agree with you. It's just an emphasis.
yeah.
Which thing are you going to emphasize?
Yeah, but that conversation is years away. So
Well,
we're
but the size of the font, I think also is a conversation that needs to take place because they will promote Dignity Health and lessen the importance of St. Rose at a corporate level.
Mhm.
And unfortunately, we would like to shift that the other way to promote the St. Roses.
Mhm.
Those are all
Where,
great.
where are these brochures gonna be? Like, what's the goal for the visibility of this?
So these are intended to be both print and digital. So what I'm working on ultimately will end up being an 8-page brochure that can be left. And it's also, since I'm creating it, it can also be digital. So
The main point, and as Andy said, it's naming opportunities. So as we're looking ahead for the coming year, etc., there's a lot of renovations going on. The 5th floor of Sienna, lots of naming opportunities. Rose de Lima, the 10 beds are on the 2nd floor now. Renovations are complete. There's lots of office spaces and boardrooms, etc., that can be named. So that's the primary reason to have this done. Fundraising. So generous donors can get their names on fabulous spots.
I know, like, just a little gala talk here, we were kind of throwing around the idea of including either that as like a live auction item or even just on a silent auction, like a super silent auction, just have the people like, oh, well, that's like an easy thing to do. You see it on your phone, you're like, oh, yes. I mean, I know it's a big ticket item, but we were kind of
Love
throwing around
that.
ideas to try to include it for gala as well.
I think that's fantastic. Yeah.
that is, I'm writing that down if that hasn't been submitted to Barbara.
Yeah, it should have been. It was in our last
Okay.
meeting, but we'll, like, make it come to fruition.
I love
Yeah.
that.
Yeah, and to give enough options for very large or moderate contributions that they could have their name on something or something that's meaningful to them.
Definitely.
Good.
The newsletter. I have a bunch of individual stories. I want to extend a thank you to Collins for agreeing to do a Q&A with me. And that will be featured in our inaugural version, our inaugural issue. The issue was originally, it should have been ready this week. It's probably going to be a week delayed. So it'll probably drop at the beginning of February. I have a meeting next week with Central to just go over the procedures for getting all that stuff posted on our website, because this is a new CMS that I'm dealing with. So
When you talk about newsletter, you aren't talking about Gordon's newsletter. You're talking about a foundation newsletter.
I'm talking about a foundation newsletter that is meant to inspire, educate, and create awareness for donors in the community. So when Gordon writes something, it is from a marketing perspective. When I write something, it is from a philanthropic perspective.
Good.
So
good.
I will always have a call to action for, just yesterday I had Brenda proofread a kindness closet story that I wrote to bring to the front line the kindness closet and what we had been doing with that. I've written a story on ECMO. I've written a story on our cardiac department. So I've got other stories that are coming down the pipeline that I just need to figure out how to get posted so
Right.
that I can.
Are there people that would agree to, like my mother was in the hospital and she had to have this life-saving event, had it not been
Yes.
for St. Rose, and because of that, we have contributed, $25,000 to their such and such unit,
Yes.
to link it with a giving, a give because of the service that they received. Can
Yeah. As
do
they
that
agree.
full loop?
As long as they agree and they sign the appropriate releases,
Right.
yes.
Right.
I'm actually meeting with a donor who has signed the release on Monday just to go over the story of his heart attack and how we saved his life. So, and this actually ties into some upcoming mailers that we're doing. Valentine's Day is just a stewardship piece. It'll just be a thank you for being an amazing donor. And then Doctor's Day is actually a solicitation, but we are taking a new spin on this. And we are highlighting 2 patients that have these great stories, and we're thanking our doctors through them. So
Wonderful. Well, and when you talk about stories of people giving and being inspired because of the service they received, it would be nice to have one story that was a large contribution and one story that was a smaller contribution, or them deciding that they would go to their Kiwanis Club and now they're one of their charities, that kind of thing, or even talking about the Rotary Club in Summerlin and how now they have adopted us for the next year, something like that, so that people could see that we aren't just talking to really rich people, we're talking about others making contributions.
Every gift matters. Absolutely.
yeah, every gift matters. Absolutely. So I am mining stories left and right now.
Great.
So Andy, the newsletter, how does that relate to Gratitude Magazine? So is that going away or?
No, great question. This is the digital version of Gratitude. So Gratitude only comes out in the fall. And so much can happen and often does happen between the time Gratitude comes out and the time it comes out next year. It only comes out once a year. And so the intent is to make sure that our donors are aware of what's going on when it happens, not a year or 6 months or whenever later, just to be more frequent with information and just give more opportunities. So Gratitude is wonderful. It does talk about the big bucket items, but there are smaller stories and smaller items that can come up that we wouldn't put in Gratitude that are perfect for the newsletter. So this would be the e-Gratitude, the e-version of Gratitude.
And this is going to be quarterly and
It's
to start
quarterly. Yeah, it's quarterly to start.
e-newsletter.
The e-newsletter, yeah. So it'll come out 3 times a year, and then the print version of Gratitude will come out once a year, and we'll see how that goes. We could.
I kind of lost track because Gratitude used to be, I think it was quarterly.
Oh,
Oh, it was. I never knew
Oh,
that.
yeah. It was a much more frequent
Okay.
thing. I think costs kind of hit us.
And
Okay. Well, that's good to know. Yeah. So
Yeah,
we're,
I think it was quarterly originally.
okay. Yeah, we're bringing it back. And right now the goal is quarterly, but if we feel that, or if we see that there's a need for it to be more frequent, then we will start publishing it more frequently.
Good.
Yeah. Review of talking points. Yay. Here, let me bring those up for you. Actually, you know what? I'm gonna do this on a separate screen. There we go. So over here. There we go. Do you guys see that?
Yes.
Okay, fantastic. So I've heard you guys loud and clear saying that you want talking points. So you are looking at the inaugural foundation talking points. Lots of
Talking points for board members so that we are familiar with everything that's going on around the hospital,
Yes.
right? Okay.
Correct. So the way I have set it up right now is by administration updates and then campus updates. But I think based on the information you're going to give me this time around, it's going to say campus because they've already printed them. But I'm going to change this language to hospitals or to hospital, St. Rose de Lima Hospital, and just start getting in the habit of using that language. So these are, go ahead.
I think it might be helpful to promote a little bit our neighborhood hospitals that we have scattered around the valley. I think we have 5 or 6 of them now. And that's a pretty neat little offering that we have that I don't think anybody else has. That it's a niche that we are mining, if you will.
Yeah.
it's a great idea. And there's a lot of great educational and outreach opportunities that take place there for our communities.
That's right.
Well, and as far as a primer is concerned, it's nice to know what services are provided at those community facilities.
Yes, exactly. And
Okay.
oftentimes it's just right around the corner from you.
Yeah, I
Mhm.
think people probably don't really understand like that that's just as great to go to as opposed to like a big campus.
That's right. Yeah.
So
Some good
the
education.
one thing that we need to clarify though, that, and I feel it's important to make this distinction, is that when you go to a neighborhood hospital, you're not going to a quick care. You're not going to, you are going to a hospital.
A
So-
real hospital.
Emergency
Yeah.
room, yeah. Mhm.
Yeah, so so people need to understand, because if they go and then they get an emergency room bill, they're like, well, I didn't go to an emergency room. I didn't go to the big hospital. I just went to one of the neighborhood hospitals. You still went to a hospital,
Yeah.
and it's not a quick care. And
Well,
so,
and that's good to point that out, that you're not just a quick care, you're a real live
Mhm.
hospital.
yeah. So yeah, I will noodle on that one and how we can present that.
Yeah.
And the reason so that lends itself to the length. This is right now a page and a half, almost 2 pages of
Mhm.
updates. You know, there has been a healthy conversation around the length of the talking points. And so, you guys drive this conversation. Are you concerned with the length of it? Is it too much? Is it too little? What would you guys like to see?
I think 2 pages is good. And add the community hospitals.
I agree. Because you want like enough information really that you can't just like throw a bullet point comment at someone and they ask a follow-up question. You're like, ha, good question. I have no idea. Like bullet point with a little explanation. I'm okay with a little bit longer of a talking point printout.
Okay,
And I
So-
agree with that comment.
so this one right now, why I put this as a separate handout is specifically because this one in and of itself is its own page. So you guys are going to get this separately. These are all of our new doctors as of this month.
Oh,
Wow.
So,
Well, that's cool. That's cool. And that's it's good for us to know. We just got some really great, doctors that specialize in children's bone and spine surgery. Not everybody has that. That's pretty cool.
yeah,
So it's nice to see that so that we've got that working knowledge.
yeah. So I
Oh,
didn't
I
want
see.
to
Go ahead.
act in the talking points. So I put it as a separate handout. So in effort to keep the talking points concise.
Yeah.
Okay. Let me. Oh, you know what? I don't think you guys see this, but this bar is right where I need to be. So there we go. Perfect. Okay. So, yeah, so I have administration updates. Something that was brought up to me that I feel I need to explain as well is, so the title of this lady, Tanya, is Market Manager Neuroscience Interventional Radiology. So within our organization, a market manager is someone that's over all of our hospitals in the region or in the city for Southern Nevada. So we added and this was actually Helen's suggestion. I thought that's brilliant because you get in the habit of seeing things through one lens. So we added Southern Nevada Market Manager. So whenever you see market manager in one of our titles, it just means that person's pretty much over everything in this area.
I wanted to mention with Allison Genco, she is our new Director of Government Affairs. She took over Katie Ryan's position when Katie moved. Allison is coming from the governor's office, and she has great experience in healthcare, is very tuned in to everyone, to lawmakers, to members of the administration. She's going to do a super job.
It's
Yeah.
very exciting.
I will share with you guys the releases that were given to us based for these two individuals. It really goes into her background and what she does. And yeah, and it's pronounced Genco, not Genco.
Genco, it might be Genco.
Okay, I'll find out.
I
And
think it is. I think it is Genco. Genco.
okay.
Mhm.
I need to confirm for both of them because
And how you say Oatgen or
yeah,
I don't know.
neither one of them have real cut and clear. Why couldn't it just be Smith?
Right. No, it is Allison Genco. I just said it wrong. Genco. Mhm.
Okay. St. Rose de Lima updates. You guys are just seeing these early. These are going to be at the board meeting. Construction on the first floor area is going to commence next week. Now that this second floor that we're on is done. The first floor, when you come in to see to de Lima, consists of, I guess it used to be a dining room, but it's going to be now again a dining room. They're just remodeling it, and then the back hallway where they used to have medical imaging is also being redone, and that's a part of the remodel and the expansion. So I'm not sure what they're putting in that area as of yet, but that's the area that's encompassed in this next phase of construction that's going to be going on here.
And all
So-
of the foundation staff is over there now, right?
Yes, we're all on the second floor now. So when you come in through the sliding doors, there's an elevator bank right straight ahead, right by the piano. Head up to the second floor and we're right there.
Very good.
Brand spanking new digs. Love it. Sienna put in ECMO here. Really quick to let you guys know, this is huge. This is happening from the largest private grant that the hospital's ever received. So we should be launching it in the fall or winter of this year, and we'll be in competition with one other hospital. This is such an important treatment that we can provide, and really only the sickest of the sick are on ECMO. So this is a huge deal.
Well, you know what? The hospital that has it is Sunrise, and HCA is the wealthiest corporation with hospitals in Las Vegas, and now we're able to compete head to head with them. So
Yes.
it's really amazing.
This is huge because this opens us up for there are opportunities with other agencies that really can put us on the map. This ECMO program is a big deal. And yes, once we open, so technically my understanding is we take patients now for ECMO, but because we don't have a fully fledged program, like a fleshed out program, we have to transfer them to Sunrise. That's going to end this fall. So once we get the 4 rooms, everything's up and running. I think right now what they're doing is working on the protocols and the policies with the doctors. And once that's done, it is a fully fledged operating ECMO program in competition with Sunrise. So we
I know you're going to talk about an open house later this month for cardiovascular, but
Mhm.
with something like ECMO, when that opens, I would certainly hope that every time there's a major opening, whether it was that pediatric emergency room or this, that all of the foundation board is invited to attend those things, and we shouldn't be
Absolutely.
left off the list. Yeah,
Absolutely.
I would have gone to the pediatric, but I didn't know about it until afterwards. So
I agree with you, Helen. It's been a real point of contention with the foundation because, and not only our leaders like the foundation board, but donors who helped make those spaces happen. I mean,
you got to have them.
The new cardiac cath lab at San Martin. I mean, many donors who supported cardiology in general, or even area of greatest need, their dollars went to create that. So it's so important.
It really is. And so
Absolutely.
who's responsible to make sure that those donors and board members are invited?
So it is a collaborative effort with the hospital and the foundation. The hospital, and we're getting there. We're building those relationships. They made it a point to call me in on last minute. Literally, they were having the meeting already, and they said, "Oh, maybe we should invite the foundation."
Yeah, thank you.
So we
Oh,
are
by the
having,
way.
yeah. Oh, by the way, yeah. And so they called me into this meeting, and we were able to drive the meeting to say, look, donors need to be here. This needs to be
Oh my
driven
God.
by donors.
Yeah,
If you,
go
ever,
figure.
if you ever
Right.
want another donation from them, yes. And also other potential donors who are you're just introducing them to the hospital, but if they can see what donation dollars go to and how fabulous it is, then they'll
Yes.
want to be a part of the next opportunity.
Absolutely.
So we are working on a date. We don't have a date determined, but it is going to be probably late February. And I have a meeting, I think this coming week to talk about more details. So this is driven by your guys' availability. So if there is something major going on where the bulk of, the lion's share of donors are not going to be in the city, we need to know that. We don't want to schedule this during spring break. We don't want to schedule this when you guys are all gone for some reason. So your schedules are driving this one. So.
Well, make sure you invite those people who donated. Those are the most important people that are there. And then I think there are enough
Right.
of us so that we can, fill in around it.
Yeah.
Yeah.
Somebody was going to say something, and I believe
Yeah,
I
I was
Go
going to comment on the ECMO side. For those of us who were involved with that project, the first go around of buying those first 2 machines, I think because that all happened during COVID, it was our way of trying to do something during COVID with the foundation, and it was brought forth. There was a couple that came in strong to really get those 2 machines purchased, and then probably about 10 of us that were involved with filling out the balance on it. Most of us never got to see those machines and so
Oh,
forth.
wow.
I would think that would be a really nice thing if you could go back and look at who those original donors, and I don't know that I could find in my records very easily without digging through a lot of emails, because I was on the phone thing calling my fellow donors to thank them for their donations, but if you could go and get that and have them be part of that coming to that opening, I think that would be complimentary and maybe kind of get some of those people back and
Uh-huh.
a little more active again.
Deborah, that's a perfect thing because so much was lost during COVID. And
Yeah.
one of the big things that was lost was recognition. You didn't have an opportunity for people to thank you for doing things. So that's great. In addition to the new donors who are giving that second ECMO. So very good. Thank you.
Moving on, Maternal Child Center over at, we refer to it as MCC over at San Martin, unfortunately was closed effective the 5th of this month. The business levels just simply weren't there to support a full floor.
Which means no babies are born except in an emergency room situation at San Martin, right?
I would imagine so, yeah. That sounds, yeah.
Yeah.
They are directed to Sienna.
Well, and the sad thing is that I remember Kim Shaw talking about the birthing centers and making them seem more like home births. But, I don't know if those kinds of services are going to be a part of the Sienna concept for birthing.
It's a great question. That's a
Yeah,
great
well,
question.
we'll have to see.
That
Yeah.
was something that Blair was particularly interested in.
Yes,
See
yes.
happen out there, and I was surprised to see this not staying together, but business is business, I guess, but
Yeah.
And communication, yes, exactly. There were lots of great ideas and lots of interest, and then getting alignment with what is actually happening and what the strategic direction of the hospital or hospitals are. Yes.
Community health. This is an area, so Rick, to your point earlier about making sure that we highlight the neighborhood hospitals, the community, and I need to check on this, but I'm pretty sure that all of our community health centers live in a neighborhood hospital. I know we have one center here inside Rose de Lima. What about
The Green Valley one is just a standalone. I mean, it's not in any kind of a neighborhood hospital.
Okay, but
Yeah.
the other ones, I believe, are. So I guess the question is, I'm probably going to have to create a second. So community health will just have its own section, and then I'll put neighborhood hospitals.
Right.
Okay.
Well, and it would be helpful to mention the addresses and locations of each of our community hospitals, just as a
Yeah.
service to the public.
I can create a one sheet with that information. I
Yeah.
believe one already exists. I will say that collectively between the neighborhood hospitals and community health offices, there are over 19 individual facilities. So that would make
19.
Wow.
Yeah, so that would make the talking points long. So I would probably just do what
But
I
it's,
did.
it's something to be proud of.
Yeah, and do a handout.
Good.
I think that's a
something
great
to be-
idea because I just found out, I didn't realize there's a neighborhood hospital here in Summerlin, Flamingo.
Yeah.
And I didn't realize because there are so many programs we do, nutrition and health and fitness and diabetes and all kinds of stuff. And I didn't realize that some services that we offer, like the prescription food, you get fresh vegetables if you qualify, delivered, etc. I didn't know that they were offered there. So that's a good idea. It's a good idea knowing what is happening where.
Okay, great. And then I put in some general operational information. So hospital operations by the numbers. This is the beginning of our fiscal year through December 21st. There you have it.
The fact that the 326 average patient visits a day to our emergency departments is, you can begin to understand, the volume and why there are times, particularly at Sienna, where there is some overcrowding. Yeah.
I just realized I think I completely missed these.
Mhm.
Brenda, did you?
Oh, yes, wondering if we should just round it off rather than down to the exact number of patients.
I suspect, shame on me, but I suspect all 50 printed that way. I'm gonna have to double check that. Okay,
Well, this isn't something we're handing out anyway, right? This is for us to use as a tool.
this is gonna be handed out at the board meeting at the joint
Yes,
tomorrow.
but I mean, we're not handing it out to anybody outside.
No.
of the- We're utilizing it as.
This is
our-
a tool, yeah.
This is our
Mhm.
tool.
Yeah, this is a tool for you
I
guys.
wouldn't worry about little typo things and stuff then.
And then our 13 specialties. So this list right here of 13 specialties is going to drive another project that I'm creating for you guys of one sheets. So there'll be a one sheet for the birthing center, a one sheet for the bariatric surgery. And this, quite frankly, serves multiple purposes, but the one big selfish purpose is that it's going to educate me on all of these topics, so that I can be a better median for, go between you guys and the hospital. So, and that's it. That's a wrap on the talking points. So what I'm hearing from you guys is you're fine with it being a little bit longer. But you do like just a few of these points for each area. Add in the neighborhood hospitals.
Yep, yep.
Right.
Okay.
Is there anything else people want in this? I think we can start with this. And if there are other things that come up in the future, we can always add to it.
Mhm.
As we move ahead, particularly as we gear up for a campaign, perhaps there could be included, significant gifts or naming gifts,
Right.
Mr. and Mrs. Smith have now named the XYZ Center.
Right. Well, with naming of gifts, I would like to show a lot of options to people. I mean, you know how much they're worth, and you know that they want to give. You don't want to ask for just a blank dollar amount. You want to give them some meat on the bone. You want to show them what it would be that they would be providing through their gift. So
there's a great way, if any of you know of anyone who's interested in any naming opportunities, at a range of levels. One of the big gifts we got last year was exactly from that, a couple that was interested in learning more about naming a space, and they were thinking maybe 150,000 over 2 years. And we did a digital proposal for them that had naming opportunities from, 1,500, 250,000, 500,000, and $1 million. And they ended up selecting 2 spaces and making a $700,000 pledge. So
Okay.
absolutely. And they're not easy to do, but being able to do those digitally, we have that software for that, and it is very functional and compelling. So by all means, let us know.
can you share with us one of those proposals
Sure.
or opportunities, just
Mhm.
so that when we're talking and the lingo we use and the examples we give them
Mhm,
are realistic?
mhm.
That
Sure.
would be good.
Happy to. Mhm.
Moving along, we have events coming up. So as we've discussed, the San Martin Cath Lab open house. As soon as I have more information, we'll go ahead and I'll share that with you guys as well. The Celebration Gala, this little thing we have called There's No Place Like St. Rose, and Barbara is doing a phenomenal job with that. There is, let me share this with you guys. This is the mail invite that you get trying to see. And as it was explained to me this morning, after I spoke with Barbara, this is an envelope, or it'll be a bifold. And so in the middle of it, you'll have the pricing and the ability to select sponsorship or just whatever ticket level you'd like to participate at. So this will be in the mail, and then the e-blast should be going out hopefully tomorrow. We're just waiting on the lawyers to give us their blessing.
Okay, so this is a point of contention for me and our little committee. We asked last week to have something drafted up that just says like two-time Grammy winner, doesn't even say her name, doesn't even include her picture. Cause like, we need to get this out now. And like, so many of us want to already be sending text messages with like a little blurb about it and like include the link and just like get it in front of people now. Cause it's only, it's less than 100 days away.
Yeah.
And so it was hopeful that we were gonna get that, and we still haven't seen that.
So yes, we were going to move forward with the e-blast without the information of the entertainer. And then this morning I was told, literally as I was getting started working on it, stop. We may have an answer about that entertainer today. So
Okay.
yeah.
I'm like, come on.
Yeah.
So
I'm sending people pictures of like, just the like, there's no place like St. Rose, and just kind of that, just to like give a teaser. Cause I'm like, I want to get it out, as best and as much as I can.
yeah,
So,
No,
okay, well,
absolutely.
that's
Yeah.
great to hear. I hope that there's something in our inbox tomorrow.
I'm with you, Angela. I think we need to go ahead and start getting things out. You can always send more details. That's an opportunity to just
Mhm.
retouch the
Mhm.
friends and colleagues and so forth when you have more information. And frankly, there are plenty of us undoubtedly who don't even really know who this entertainer is. I mean, it was meaningless to me, and it will be to certain other of our people. So people aren't coming for that entertainer. They're coming for
Yeah, you rarely
the
do attend a
event.
gala for the
They're
entertainment.
coming for the event as a whole. So I think, whoever is there, they're gonna enjoy the fact that they're there. And if they're a more exciting entertainer, then they'll be more tickled after they get there.
So am I the only one that doesn't know who the entertainer is?
Well, apparently I'm with you.
No,
I
no,
don't-
I didn't even hear a name. You heard a
Oh.
name and didn't know who she was. I don't
is it?
know who is it?
Well,
Colby Calais.
Who?
Colby
Colby-
Calais.
She's one of those artists that if you heard her songs, you'd be like, oh, okay, I know that song. I still didn't know that was Colby Calais.
Colby Calais. Okay. Well, that I agree with you, Deb. It doesn't mean anything to me.
Yeah, same. I don't know who she is, but I understand she sings a lot of great songs.
But there might be some people that would love to see her that we can capitalize on her being there.
Mhm.
Yeah.
Yeah. Rosebud Auxiliary. So I'm doing a little bit of support for the Rosebud Auxiliary. They have an event coming up on February 28th to celebrate their 5th year as an organization in support of the St. Rose Dominican Hospital's cardiac services programs. So this is a great group of ladies and Rose Buddies. That's what we call the ladies Rosebuds, and the gentlemen are Rose Buddies. And yeah, they have an event coming up at the Revere on the 28th of February. If anybody is interested in learning more about that, I will be happy to share more information.
The auxiliary is honoring John Van Boning at their event. They're going to give him an award and thank him for his service to St. Rose as he looks ahead to retiring. So it'll be a lovely event. The Rosebud events tend to go a little bit longer, so it may be from 11 to 1:30, 11 to 2. But you're welcome to come and stay as long as you wish. Member tickets are $65 and guest tickets are $75.
And when are they? When is it?
February 28th, and it's going to be in Sun City Anthem at the Revere Golf Club event space. And there will be a raffle and 1 or 2 or 3 silent auctions, and a very social, will be a fun event.
Current stewardship projects. There are no cards or calls that I was advised that we have to send out this month. I will say thank you to Dr. Chavez for helping with the ones over the holiday. She was instrumental. We got them all out. So lesson learned, we probably shouldn't plan to do these during the holidays. So foundation and hospital resources. So when this meeting wraps, I am headed over to the print house and picking up, let me show them to you. these. So on the front side, they're little informational business cards. I call them biz cards because they're the same size as the regular business cards. On the front side, it has foundation information. This particular little scan code takes you to our link page. If you've never visited our link page, it's basically a one-stop shop for all of our social media handles, foundation website, Gala, Ways to Give, Rosebud Auxiliary, Children's Miracle Network, and then this Contact Dignity Health. This is a secured channel. It complies with federal and state privacy laws. And if we go back here, that is this same link right here. But so it's another way to get to that secure channel if anybody wanted to communicate with us. My understanding is that when you send an email to this secure channel, it actually goes to Randy Boynton's office, not Randy Boynton proper, but his office, someone in his staff who does monitor that box and routes those emails as needed and appropriately, as is appropriate, excuse me. This dignityhealth.org Las Vegas locations, yes, I put the different information for the different campuses, phone number and address here. But this link has so much more, way more than I could put on a little business card. And then we have physicians referral service and billing and disputes and appeals. So it's just meant to be a little quick, here you go. It's a tool, and I will be picking these up today after we wrap here.
Wonderful. Great resource.
Yeah. Any other business? We've reached the end.
Okay,
Selfish-
well,
Selfishly, just invite people to the gala, sell tables.
We
yes.
all need help. Yep.
You're gonna hear it again tomorrow, sorry.
No worries. I have the next meeting date scheduled for March 20th, 2024 at same time, same channel. If
You'll send
everybody,
us, you'll send that to us.
you will have that momentarily. Yes.
Great.
And any other action items? I do have adding the neighborhood hospitals to the talking points. Anything else?
Yes, could you add the Overture, send a sample of an Overture digital proposal? I can show you that link.
And
Thank
it's spelled that way. I'm not, yeah, no.
There's no E, it's, yeah.
Yeah, I know.
Right, yeah.
It is purposely spelled without the E. Anything else? No? We're good. All right. And if anything pops up between now and the next meeting, please feel free to send me any agenda items that you'd like me to add. I think
Right,
that's
and
it.
you'll let us know when the Cath Lab event is occurring and an invitation to that.
Yes, ma'am.
Great. Okay, well, thank you everyone for attending. And we'll see you at the board meeting tomorrow.
You
See you
bet.
tomorrow.
Thank you.
Take
Bye,
care.
everybody.
Bye.
Bye.
Bye.